I think the latest breaking news from the U.S. Centers for Medicare and Medicaid Services, CMS, reflects some of the most significant changes in American healthcare. They are now approving CT lung cancer screenings for Medicare. And this is straight off the press. It really is a watershed decision that says they highly endorse preventive screenings. Catch things early. Catch things before there's problems. This is something that Advanced Body Scan has believed since the very beginning. That's why we've started the company. And it really does validate what we have been saying all along. If you can find these things early, we can make significant changes in the outcome. The procedures are generally simpler, safer, more effective. It means cost savings for taxpayers in this case, but cost savings for families as well. And the cost savings are significant because it's not just money, it's hardship, it's stress, it's all the things we go through when a loved one becomes seriously ill. It's life-changing. It's not just life-changing for ourselves, but for everyone we touch. And that's why this new ruling is so significant. But again, it's what we've been saying all along. And we've seen it. We've seen it. We've now screened over 15,000 people here in Oklahoma City. And granted, for most people, the real benefit is peace of mind. But not for everyone. And unfortunately, we find things in people who think they're perfectly healthy. Doctors who think they're perfectly healthy on a personal level, not just their patients. Myself, I have a nodule in my lung. It's small. It appears to be benign, but I would have never known about it had it not been for the screening. Now I can watch it. Now I can monitor it. Now I can make sure things don't change. And that provides me tremendous peace of mind. So that's why this new ruling is so significant. That's why it validates why you need to have this kind of test. And many people think, well, I don't really need that. I'm not a smoker. Guess what? I wasn't a smoker either. I've never smoked. But there are other factors. There are other pollutants in the air. There's wind and dust in the air. All those things affect us. Affects all parts of our body, but especially our lungs. So that's why this test is pretty important for really anybody. And then of course, if you have been in a smoky environment, or you have been in a chemical environment, or you have been, even if it's been 20 years ago, if you have been a smoker, it doesn't matter. 20 years ago, 20 minutes ago, doesn't matter. You need to know. You need to know, am I okay? Because once you know that, there's plenty of things you can do, but you can make better choices. And that's what our mission is for really all forms of cancer, as well as heart disease.